Hello everybody, I am Dr. Neena Malhotra, a professor in the Department of Obstetrics and Gynaecology at the prestigious All India Institute of Medical Sciences. Vibrate, the e-bridging intellectual platform of the Indian Fertility Society, through which today I deliberate on the subject of genital tuberculosis. The topic of genital tuberculosis is truly a gynecologist's Waterloo. Obviously, because the diagnosis of genital tuberculosis spells poor prognosis, undermining the success rates of fertility treatments. But what are the very many challenges in managing women with genital tuberculosis? Perhaps we still do not have a case definition of genital tuberculosis, unlike pulmonary cause. Also, despite the availability of so many molecular methods, we are still in a dilemma to write anti-tubercular treatment to some of our patients. Being a lead investigator to the multi-centric taskforce ICMR-funded project on genital tuberculosis, I had the opportunity to find answers to some of these questions. So, if you want to find answers to these dilemmas, join me on Vibrate on the Tuesday 14th of July between 3 to 4 p.m. when I present interesting case series on genital tuberculosis. So Vibrate with genital tuberculosis case files this coming Tuesday. I would take this opportunity to thank Zydus, who has generously supported and sponsored this academic endeavor of the Indian Fertility Society. I also am thankful to DocMode, who are doctoring this program Vibrate for us. So dear friends, don't forget to log in this Tuesday, 14 July on Case Files. Thank you.